This is Dr. Sandra Lora Cremers, one of the eye surgeons here at Visionary Eye Doctors, and I want to speak today about the causes of dry eye and the treatments. Some of you have seen this stepladder sheet, which is all the treatments in the world for dry eyes to date. A patient many years ago at Harvard asked me to put everything on one sheet for her, and I did, but it can be a little confusing. So I'm going to go through the causes and some treatments. And so if you're having any of these symptoms at all, such as burning, which is one of the most common symptoms of dry eye, reflex tearing, meaning you're tearing a lot, especially when you go out, that's because the tear film is unstable and it dries up too quickly, and a reflex occurs where there's more tearing involved because the tear film is not complete. If you have that, that's classic for dry eye. Also redness, foreign body sensation, inability to tolerate your contact lenses, itching sometimes as well can be associated with dry eye, although itching is sometimes from allergy. And the way we determine the difference depends sometimes on skin allergy tests and histories of allergies as well. Blurry vision. So the tear film is important in the quality of the tear of the vision. If the tear film is not perfect, the quality of the vision may be affected. So if you find your vision is great sometimes and then very blurry other times, that's classic for dry eyes. Light sensitivity is another one, and of course inability to tolerate your contact lenses. The key causes are aging. We all are getting older, and the hormonal changes that occur when we age affect the tear film, and that can cause dry eyes. Another cause is genetics or diet. If you're eating a poor omega-3 diet, not too many omega-3s, that directly will affect the composition of the tear. So we recommend more omega-3, 2,000 to 4,000 per day milligrams of omega-3. And environmental causes, excess computer. It's important to take breaks, close your eyes, walk away. Sometimes using artificial tears will help if you're at the computer all day. If you find your eyes are getting tired, very droopy in the afternoon and evening, or very just tired sensation because you're at the computer all day, we want you to take more breaks, and some of the treatments I'll recommend will help with that. And pollen, of course, will sometimes exacerbate dry eye. Constant contact lens use for many years. If you've had a history of LASIK or PRK refractive surgery, that can be a reason to have now dry eye. So we'll give you some treatments for that. And then finally, if you have any type of internal inflammation, if you have arthritis or joint aches or dry mouth, you need to let us know, because it could be something called Sjogren's syndrome, which is inflammation in the body that is causing inflammation in the organs around the eye that produce the tear. So let's go through what that entails. So here is a schematic showing the key glands and organs involved in the tear film. This is the lacrimal gland, which produces the watery layer, or the aqueous layer, which is the middle layer of the tear. So the tear has three components: the aqueous, which is the watery middle layer, and that's produced by this important gland here located on the side of the eye. The Meibomian glands are located at the base of most eyelashes. There's about 20 to 30 on the top and then on the bottom. And that produces the oily layer on the outside. That's in charge of keeping the tear in the eye longer and preventing evaporation. And then there's these tiny cells on the white part of the eye called the goblet cells that produce the mucin layer. That's the inner layer. If there's any of these components are not perfect, your tear will be unstable and will dry too quickly, and it will lead to reflex tearing or redness and sometimes pain. There are patients that sometimes get conjunctiva calluses, which means that the clear surface on the white part of the eye, so the clear covering on the white part of the eye called the conjunctiva, develops folds right along this area, and it's kind of like wrinkles, we sometimes call it, and that can also lead to an unstable tear film. So if we go back to the treatment of dry eyes, conjunctiva calluses is discussed as number 4. We don't do anything to treat that unless nothing else is helping, because the way we treat that is sometimes with a laser procedure, and if that doesn't work, we'll actually surgically tack it back down or cut out the wrinkles to make it tighter. So most people do improve with some of the treatments, and we don't have to worry about that. But if you've had many treatments for years for dry eyes and nothing is helping, and your doctor says you have conjunctiva calluses, that's something you should discuss further. So going into the details of step 1, which is the most important step out of all of this, is called the Lid Hygiene Instruction. And basically it's meant to be done like you brush your teeth. You brush your teeth 2 or 3 times a day. You should be washing your eyes really at least twice a day. And when I say lid hygiene, this is the best way to do it. This is based on studies that have been done for years. That's natural, it works. You'll see that this is the best way to make the Meibomian glands work the best that they can. So the first is to wash your face, and the washing the face with warm hot water. I tell patients as hot as you can stand it without burning the skin for all of this. Then a warm compress. The studies say 15 minutes twice a day. Nobody has 15 minutes, it seems, but as much as you can. If you can do it 3 minutes in the morning, you can take a hot towel, hot tea bag, warm beads in the microwave they sell on Amazon, anything that keeps heat or changing it when it gets cold on the eyelashes, on the eyelids, opens those Meibomian glands, which are located right here. Here's a schematic where the oil comes out of these glands and makes the tear more complete. Then that we like to do twice a day, especially if you're feeling your eyes. If you find you're starting to develop a sty or a little ball on the top of the eyelid, then you do the warm compress, as I say, even 100 times each day. You know, where you take it, put it on when it gets cold, dip it in hot water again, without burning the skin. The heat is the only natural way to open those glands, so keep that in mind. And then we have patients wipe, and I wipe with something called tea tree oil or clear, which is Clearadex. And I have a sample of that. So Clearadex comes in a little box like this. It comes in a little packet that sometimes I cut in half and put in a Ziploc bag so I can use each towelette twice. And so after I wash my eyelids and then I put a warm compress, I take a towel and just scrub my eyelashes with my eyes closed like I'm brushing my teeth. Keep it on for a minute. Wash it off before I open my eyes. The first time I used it, it burned like the dickens. But the company says it's due to mites and bacteria in the eyelashes that are dying. And after about 2 or 3 days, I could just leave it on without having to wipe it off. So if it's burning too much, you can take the towel and just dip it in a little bit of water till you can tolerate full strength. Once you get used to Clearadex, you can even buy over-the-counter tea tree oil and dilute it according to my instruction sheet. Let's see. The next one is Abenova, which works very, very well. I have no stock in any of these companies. This one is a spray. So warm compress first, just spray it right on your eyelashes. You can wash, you don't have to wash it off. This works very well. It does not burn, and you can use it with your contact lenses in. That's a great way to just use daily, at least once or every other day if you're starting to notice your eyes. And then diluted baby shampoo is not a bad idea for most patients as a routine treatment when you're in the shower or in the bathroom, but some patients complain it dries their eyes out more. So different people are different. Some of this treatment will work for some people and not for other people. So kind of keep an idea, a diary maybe of what works for you. And if diluted baby shampoo is working, you can use it. If it's not, try one of these other products. OcuSoft foam, similarly, some people love it, some people don't. And so I have patients try some of these non-steroidal treatments because they will keep you stable, so you don't need steroids in the future. We have patients then wear an ointment at nighttime. So that's a little ointment we put on a clean finger right after you've done your warm compress, rub it into the eyelashes, go to bed. In the morning, wash it off with warm water. It does two things. It forces you to wash your face in the morning because it will blur the vision if you don't. And it suffocates any microbial mites or bacteria that replicate at nighttime, such as Demodex. Demodex is a mite that is on everybody at some point in their life if they live long enough. For some people, for some reason, people with rosacea tend to attract Demodex more than others. So we like tea tree oil for that reason, and some type of gel, even coconut oil has been said to help on the eyelashes at nighttime to just suffocate those critters from replicating. So that's the basic lid hygiene instruction sheet. Number 2 on my sheet has to do with diet, and as I mentioned, we recommend 2,000 to 4,000 milligrams of omega-3 a day. You can take that in the form of wild fish, seaweed or chia seeds, flaxseed, or you can take it as a pill. And there's various products. There's one called BioTears, which is a medical grade omega-3. There's PRN, which works very well. The best way is naturally in the form of foods. And so I encourage patients to read step 1, 2, and 3. Number 2 also discusses things like not sleeping next to the fan, using a humidifier next to you, eating a low carb, low sugar diet, which hasn't been proven, but it's good health, we think, helpful to your health. And there's some evidence that it helps some people with their dryness of their eyes. Some of the other natural things you can do are buy something called Tranquil Eyes, which is a moisture chamber type of goggles that you can sleep in to keep the moisture in. You wet the inside and that kind of keeps the moisture in. Personal humidifiers are sometimes helpful if you're in a car for a long period of time. So these things are available on Amazon. And those are the key things. If you have any other questions, I have other videos on YouTube about the other steps. We go on to the next step. If your symptoms on a scale from 0 to 10 are more than a 5 out of 10, 10 being the worst your eyes have ever felt or the worst pain you've ever felt. If people are noticing their eyes more than half their day, That's not good. We do not want you to notice your eyes. You should not feel your eyeballs when you blink. That should be effortless. So if you feel your eyes when you blink, then we know you need to start a new treatment or consider a new treatment. So if you have any questions about that, please feel free to email me. Thank you.